I remember some of my stay in critical care unit. I was on for 5 weeks and I've no memory of about 3 weeks in the middle of it.
It was a rush job. I'd had Legionnaire's disease and I had to have a ventilator, and where they'd put the ventilator down it caused some scar tissue on the trachea, and hence the reason I needed one. I couldn't breathe.
I had a holiday just after Christmas, and during that time I became ill with what I just thought was a virus, and it turns out I'd actually got pneumonia. So then in critical care I was being treated for that.
I remember being frightened because I didn't really have a clue what was happening.
I think I'd been unconscious or confused leading up to that, so I wasn't aware I needed a tracheostomy.
The tracheostomy was done while I was totally out of it.
It felt like I had broken twigs in my throat. Yeah, it was very uncomfortable. Yeah, experience. I think that settled down after a while, but initially that's what it felt like.
Yeah, just a feeling of not talking, not being able to talk, and just air coming out from my throat. It was all a bit strange.
I couldn't even focus properly as I was coming round, if you like. So I certainly didn't realise all the equipment I'd got connected to me at the time. It took a while. Once I realised I'd got the tracheostomy and everything, it wasn't an issue at first. However, it became an issue over time. But certainly initially, I wasn't aware of it even being done.
It was quite difficult being through a tracheostomy. I was on the ventilator to start with, and then as they were weaning me off that, I found it very, very difficult to breathe, and I had quite a few panic attacks when they were trying to wean me off the ventilator.
My oldest son was only 2 when I had it done, so that was a bit scary for him as well as for me, so it took a lot of getting used to. And then when it was first done, I was coughing a lot, and that sort of made the tube come out a lot and everything, so it was all a bit frightening.
I was a little bit concerned how I could breathe through such a small hole. Yeah. That was my main concern.
And I hadn't really heard the word tracheostomy before, so I didn't know what to expect really.
When the tracheostomy the equipment's being cleaned, the nurses used to have a routine of coming round and cleaning it, and I was very conscious after a while of how the nurses did it, because sometimes I would actually pass out, and it was called, vasovagal. So I became, obviously a bit concerned when people came to me. I used to say to the nurses, "Go easy," and then the next thing is I know I'd have passed out, and then I'm coming to again, and there's half a dozen people kind of stood over me like.
I don't really remember much about the tracheostomy care other than when they were suctioning, and I could remember, the suction experience, and then the nurse that had a little pink bottle of water, and she used to flush the tube in with it afterwards, and I thought it was perfumed water. It must have been, she had perfume on her when she got close to flushing it. I didn't feel like I was holding my breath or anything when I was having suction, but it just made you cough so violently, you felt like your eyes were going to pop out. So
I knew certain nurses were okay, but other ones, that didn't really know me, if you like. They did the suction quicker, or I think it was to do with speed in the way they did it, if it was done slowly. But as one of the nurses explained, if you do it slowly it doesn't work properly or whatever.
Surgeon did, but I didn't find anyone else really knew what to expect. It was new for everyone, I think.
I did have confidence in the staff. At one point, the tracheostomy got dislodged, really? And the nurse just said, "Right, you're fine, I'll go and get a doctor." Yeah. And she came back within a couple of minutes, and I don't know if I said to her, because I don't know if I'd be able to speak, but I was like, I trust you, I'm not worried. Right. So she made me feel, very at ease.
I think I was fed through my nose. Would that sound right? Yeah. So I just remember bottles being changed every day. Because I couldn't drink or eat like a normal times, I actually began to like it when they put the thing in, because it had come out of the fridge and it was cold, and that sensation going down, it was the nearest thing you could put to being fed, if you like, because you hadn't tasted or drunk for so long.
It was very frustrating not being able to speak. When you have family coming to see you, I felt an obligation to try and entertain them. My sister, who talks for England, never said a word when she came in, and I told my husband, I said, she's going to have to talk because I find it so tiring. And I was trying to mouth words when I had a tracheostomy in, and then you just give up in the end when people can't understand you. I did have the psychotherapist come and see me, and she was able to lip read, so that was a great relief when somebody who could lip read came.
It was hard work, and of course, again, because I was so weak, and people said, oh, well, do you want to write it down? I couldn't even hold a pen.
I have got a little piece of paper where I did write something down on, so I must have been given paper and a pen at some point. But I've no recollection of being given any other aids.
The things the kids have, like a child's thing, yes, yeah. But I think I was just that fed up and tired, and I just couldn't use it, I
remember having a speaking valve, and there were two different sorts. When they first put one in, it used to make me retch. When I first put it in, like real acidic phlegm used to come up, and I found it very tiring as well, talking and breathing at the same time, so I only had it in for quite short periods. But that did get better. And then he had another one with a funny name called a Swedish nose, and that was right at the end, and nobody told me to press on it to talk, so...
Nobody knows that you can do that.
No. But that was easier, to talk once I'd worked that out.
The first time they fitted the voice valve box thing, it were amazing, but again, it tired you out. It obviously helped me communicate, but I would be very conscious of how long it was in for. I would be saying to the nurse, can you take it out now? And you could just about communicate with your voice, even with it not in.
To the best of my recollection, they told me what they were doing and why they were doing it. They were very supportive, very encouraging, both the nurses and the physiotherapists who worked with me. They did explain things to me quite clearly. I say I have problems remembering some of it.
I felt more vulnerable at weekends than I did during the week, because I felt there was less staff, and there was certainly less. If you would have a test, you would have to wait for the results till a Monday and stuff like that, or the Tuesday. And so that was one thing I do remember, was kind of feeling vulnerable at weekends and bank holidays.
I only really realised it was a problem before I had my second son, because there were questions about whether I could have it reversed. And everyone was a bit worried about the effect of having it reversed before I had a second child, so it was just left in situ, and it's been like that ever since.
It was taken out the day before I was discharged to the ward.
Well, I was in the hospital for 7 months in total. I think it was somewhere around about April, I think it was taken out.
I'm very much a get up and go sort of person, so just accepted it and got on with it, really.
It was good, yeah. It was a relief, yes, because you could move around. You always felt like you weren't able to move your head in the bed, while you sort of were connected up to everything. So, yeah, it was a great relief to have that freedom.
Apart from the fact that initially still I couldn't have food or drink, the first thing they did was train me to use the voice thing, and then the sipping water, and actually doing that conscious swallowing so that it avoids going into the lungs. Or
I think again it does frighten a lot of people. When I was on dialysis before, at the unit I used to go to, I quite often needed suction because the pump speed was so high it would have an effect on my breathing. So yeah, I mean, it has caused unforeseen problems.
I was a student nurse, so I had looked after patients with tracheostomies, so I did have knowledge, and as I say, I wasn't with it, to be told and be given information before it went in.
It was a life-saving process, and I know my 2 daughters and brothers and my sister were all there at the time, and they were aware of what was going on, and they said it was amazing, because that kind of saved my life, if you like. Most of the time they felt very happy with they had a relationship with the staff there, and critical care were very good for the first couple of weeks. My 2 daughters stayed at you had like a motel or whatever there, and they stayed there. So they were virtually with me 24 hours a day.
I was sent home with a sort of bag full of equipment to suck any suction that was needed, but apart from that, no.
It didn't feel any different really to eat and drink. Yeah, my taste buds had changed quite dramatically.
Did you taste it at all?
Yeah, everything tasted salty, the food tasted salty, because I hadn't had anything to eat for about 5 weeks. And my first cup of tea tasted horrible, because tea doesn't really have a nice taste, does it? And but I had no problem swallowing the food or anything.
I used to have to go up to the hospital, I think it was about once every 6 weeks when it was first done. And I just said, can't I do this at home?
I've never been able to sing very well, but when I do go to the odd wedding or a funeral, my voice, it hurts to sing. It's like it's straining my voice. And the only other thing is when I'm swallowing certain things, apples and nuts and tablets, I must have a little ledge or something inside. Yeah, a bit of scarring, and a piece of apple or a tablet could sit in there for 3 days quite happily, and I just have to turn my head upside down, press on my throat, cough it back into my mouth and swallow it again. It's a very neat sky. All I've learned is to chew things properly and drink with lots of water. We'll have water before I swallow, so. But I'm very happy with the sky. I did think it was going to be quite unsightly. I was quite worried.
My granddaughter commented on it last night. She was saying, "Does it not hurt?" So I said, "No. I'm diabetic. I'm always conscious of things not healing quickly, but amazed and some of the things I've had done in the last year and how quickly they do heal."
You get used to it. You do know what to expect, and it becomes a habit rather than a problem, really.
Having a 3-week gap where I've no memory of, I found quite disconcerting. So if you're able to, talk or mouth words, that's a definite bonus. Interact with people, even if they can't understand you. At least, some people can. But not to be worried about it. It's just there for a reason and a short-term solution in my case.
I think probably 40 years ago I just assumed it would help with my breathing and it would be a temporary measure. However bad it seems, there are a lot of worse things out there, so, just a matter of keeping at it, really.